The COVID vaccine is supposed to give you an immune response. We know that. But what about the people who are on medications that suppress their immune system?
Washington University is now looking for answers, and Justina Cornell from our vaccine team has more.
Lupus has been up and down for me since 2001.
Lupus has taken a toll on Marshallay Bernard's life.
For the last 10 years, I've been in remission.
Medication helps her stay in remission. So when the vaccine came in the picture, her first thought was,
how is the vaccine going to affect a person with an autoimmune disease like lupus?
Many questions with limited answers.
There's actually very little data, particularly with COVID-19 vaccination and the type of responses, whether or not they're going to be protective or sufficient enough for them.
This motivated WashU assistant professor Dr. Alfred Kim, setting up a trial to evaluate the effectiveness of COVID-19 vaccines in people taking immunosuppressants. This ranges from arthritis to Crohn's disease to psoriasis. Bernard is one of the 100 vaccinated participants.
The first stage was the blood draw, which was extensive.
The trial tests the quantity and quality of the antibody response.
Early on, without telling you too much, we are seeing certain types of medications in particular may reduce antibody responses after vaccination. All we can say is that with certain medications, we're definitely seeing a reduction.
Dr. Sarah George with SLU School of Medicine says these patients can still get COVID, but it may not be as intense.
We still see some mild cases breaking through, mostly in people who are immune compromised.
Berna believes the vaccine gives her a fighting chance and hopes with her input, she can help others.
There were people before me who tried the medications that I am now on that's helping me. And I'm thinking, if they hadn't have did that with the medications I take now, they wouldn't have known how to treat me. So now I feel like I'm paying it forward.
About 100 people are currently in the trial, and they're hoping more people will sign up so they can get more answers and more data.
Justina, the results of this trial are crucial. I love what she said at the end about how she's giving back, she wants to help others. But I bet most people watching probably do know someone who's immunocompromised when you talk about rheumatoid arthritis, lupus, any autoimmune, plus some cancer treatments can suppress your immune system. So there's certainly a lot of people this study could help.
Right, so 2% of the U.S. population is affected, and you're probably wondering, well, 2%, that's maybe not a lot, but in reality, if we break down those numbers, that's 6 million people, that's 6 million lives affected, and those are people just wanting to get answers.
I know Johns Hopkins doing a similar study with organ transplant recipients. Many of you know I got a kidney transplant, so I'm on those drugs. Just as a rule of thumb, what if the doctors told you in your report today, your research talking with them, what should immunosuppressed people do? Get the vaccine or not?
The head of the trial, Dr. Kim, says to get the vaccine, especially for those who may be affected with COVID-19 and get severely sick. So definitely get the vaccine. But if you're on the fence, reach out to your doctor, have that conversation, and from there, make an informed decision. Reporting in St. Louis, Justina Cornell, 5 on your side.